Starts With You is a Healthwatch England campaign which really just drives home the message that in order to improve services locally and nationally, it starts with you, members of the public, who are able to tell us messages about how services can improve, and by using the powers that Healthwatch have, we're able to work with commissioners and providers to really make changes. But we couldn't do that without local people sharing their experiences with us, so it really does start with them. At Healthwatch North Tyneside, we love to listen to people's feedback about health and social care services because we know that this can create real change and real improvements to services. So we go out into the local community and listen to people's stories about health and social care, and we help those people to find those services and to make sure that those services are in place to meet their needs. Our Enter and View volunteers have gone into Rake Lane, into 2 wards, and they listen to patients' experiences of food.
Healthwatch approached the organisation about coming in, meeting our patients and staff and talking through the mealtime experience. So the recommendations that came out of that were about the enhanced use of the pictorial menus.
The menus are actually really helpful, especially for care of the elderly, so they can point and tell us what it is that they would like to eat.
Prompts at the bedsides around patients that needed assistance with either drinking or nutrition.
We've got 2 little signs and we use these to show people if the patient needs assistance or supervision.
A nutritional assessment for all of our patients that are admitted to hospital.
I put the names of the healthcares on to see who's doing what job at dinner time. We've also got volunteers who come in, and once the kitchen's closed, you just have to phone the porters, and the porters have got access to the kitchen to go and get snack boxes if or when they are hungry.
The recommendations have made a positive impact on patient care. They have enabled us to focus on the important issues, and it's great that we're able to celebrate the fact that we have made huge improvements over the last 2 years.
We've also been able to listen to the views of people and carers from local care homes about activity provision.
I got involved as a volunteer for Healthwatch North Tyneside because I particularly wanted to help improvements in health and social care. I take part in the Enter and View visits, and this is where we go to care homes and we ask residents, family and friends about their experience of living in the care home. They are collated to compile a report, and when that report is published, it's shared with all the interested parties.
Healthwatch North Tyneside, by producing a report, ensure that the managers within the homes get on board with regards to what they want to achieve in the homes in North Tyneside for the benefit of the residents.
But Healthwatch North Tyneside are instrumental in what I do in the care home. I got their copy of their Living Life to the Full report, and it was really helpful to have everything listed there. Daily living activities, physical activities, how you can work with community, having it all laid out and how I could then use that as a template in my daily work.
And at the forum we're able to share ideas. It's really good support for the activity coordinators.
I have to thank Healthwatch North Tyneside for giving me the confidence to go ahead and work as an activities coordinator every day.
And I'm delighted to say that we see lots of improvements as a result of the reports that we've written.
It's good that the Healthwatch North Tyneside report will make the lives of people in the care homes within the North Tyneside better.
To get the experiences of local people, we go out into the community in different places and ask people general questions about their experiences of using health and social care services. Sometimes in giving us those experiences, it becomes clear that someone has an unmet need or they want to access a service that they haven't been able to find, and we help signpost them to help them find those services.
SIGN is a network in North Tyneside which stands for Signpost and Information Guidance Network, and its range of information advice providers, of which Healthwatch North Tyneside are one of them, supporting people on a range of issues around things like care and support and health issues and health advice. Healthwatch North Tyneside's expertise in the network is really important. Certainly Healthwatch provide us with that element around health advice and health issues and how people can get support where they've had problems in the past.
We also have surveys and an online feedback centre where people can leave their views about services, and that's available for anyone to see. So when making decisions about which services to access, they can look at reviews of services online, like a little bit like TripAdvisor. Well, it takes a while to create impact, but this year we've been able to see quite a lot of examples of that. So we've been able to take feedback, look at the trends in that, go back and make recommendations to commissioners and providers and create real change in the way that services are delivered and therefore experienced by local people. We also listened to over 270 people who had used mental health services in North Tyneside, and we used this information to help make sure that local people's views were at the centre of the development of a mental health strategy, and that strategy is being implemented now.
Healthwatch has helped us hear the voices of people who need to use the mental health crisis services, and as a result of that they've been contributing to a review of the mental health crisis pathway. Healthwatch has made a big difference to the way that we can hear the voices of people who use mental health services and help us to improve those services.
We're not here just to hear the views or go out and get the views of people about their experiences of healthcare, but unless we can actually make some impact with the people who commission and deliver those services, then we're wasting our time, I think. And so we spend a lot of our time trying to make that influence by representation on different boards, committees and so on, so the people who commission deliver services can hear directly from us the experiences of people of those services. And so we speak regularly with the chair and chief executive of those bodies just to reinforce that message and to make sure that when they do commission services, they do reflect the needs of the people of the borough.
I think Healthwatch makes a huge difference to people's lives because in encouraging them to have their voice heard about their health and social care services, their voice can then reach the commissioners of the services and the service providers to help services improve.
I would recommend Healthwatch to any family either caring or looking after people with illnesses, because you don't get any training to be a carer, and sometimes you just need some guidance and they signpost you to other organisations. So don't be shy, pick up the phone, ring Healthwatch North Tyneside.
It starts with you.
It starts with you.
It starts with you.
It starts with you.